Good morning, everybody. It is Dr. K from the Eye Institute. We just finished up our LASIK post-ops. Everybody was doing great this morning. The two more complex cases we had from earlier this week were also doing well. One of the things I want to talk to you about today, though, is cataracts and knowing when cataracts are ready for removal. I always get asked by patients, how do I know if it's time for me to have my cataract removed? And a lot of patients are asking about whether their cataract is quote unquote ripe enough to be removed. Because a decade or two ago, we used to wait longer to do cataracts. We used to wait until the cataract was of a consistency that it was easily broken up and more easily removed. But now that techniques have evolved and changed, and we're using more ultrasound and smaller incisions and laser in some cases, we don't use the term ripe like we used to. The cataract doesn't have to be ripe or ready to be removed in order for you to have cataract surgery if you want it. Now, these days, there's really two things that play into justifying whether or not you should have something done. And which one's more important depends on how you want to look at it. But the first thing is, is insurance going to cover it? And they have certain criteria. And in general, we follow the Medicare criteria of vision. And so if your vision is reduced to the point because of the cataract that qualifies for Medicare, that's one thing. And then two, glare vision plays a role. So if you have a significant amount of glare that reduces your vision, then that's another factor that can qualify you from an insurance standpoint to have cataract surgery. So that's one side of the coin. The other side of the coin is you as the patient. Are you as the patient frustrated enough with your vision on a daily basis to want something done? Because there's risks and benefits to cataract surgery, and that's something that we'll talk about more in the office or maybe on a different video. But the question for you as the patient is, are you ready to have something done? And usually what I ask is, are you frustrated enough on a daily basis with your vision, with the quality of your vision, that you want it improved and you want something done? Okay? And it doesn't matter as much what the cataract looks like as long as it's there. You're having visual symptoms that are frustrating you or keeping you from doing what you need to do. And then if the cataract is reducing your vision enough to qualify for insurance coverage. And more often than not, you meet the insurance cutoff before you're frustrated enough on a daily basis for you to actually want surgery. And so those are the two major points that factor into whether or not it's time for you to have your cataract done. Because insurance, you could have good insurance coverage, but you could say, I'm doing pretty well on a daily basis. I'm doing everything I want to do. I'm doing everything I need to do. I don't really feel like my vision is impeding any part of my life. And if that's the case, then there's no reason to do anything. So we want to make sure that if you're thinking about cataract surgery, those two things. Those are the two factors that I always want to discuss with patients. Okay, so hope you folks are having a great day. I hope that gives you a little more information about how you know whether your cataract is ready to be removed. And if you have any more questions, put them down in the comments or give us a call at the Eye Institute. We can help you out. You folks have a great day.